Hello, everyone. Welcome to another assessment by LAMP Foundation, LAMP Training Center. We are starting on a new module, this time on TCM Foundations. For today, we will talk about the history of traditional Chinese medicine. Let's start the ball rolling with who would like to volunteer? Oh, siguro
Like,
si...
Sige, Doc. Ready.
you ready, Doc?
Yeah, I know. Hindi ko natatawagan yung batch 2 kung walang sasagot. Okay, si Sir. Okay. Ang tagal-tagal din natin nawala, no? Ang sinorkan. Sir Froilan de la Cruz, can I call on you? Sir Froilan? Or Dr. Froilan? Yes, very good. Ang ganda naman ng kanyang ano. Okay, let's start, no? Let's do away with with chikahan.
Ako na.
Okay, Dr. Sabihin ko na Dr. Froilan para matapos na yung naturopathy mo. Okay.
Ah,
Sige. Okay, so let's start with the first one. When is the old Stone Age in China? So you have to give the date.
The Old Stone Age in China, also known as the Paleolithic period, spanned a vast time frame beginning approximately 3 million years ago and ending around 10,000 years ago.
Wow. Or 8,000 years before Christ and prior. Yeah, you were correct. 10,000 years ago. Wow. Okay, what do you call the period in human history characterized by the use of stone tools and the development of agriculture?
A Neolithic period,
Okay. Or what we commonly call the New Stone Age, Neolithic, 6,000 to 4,000 BC. So 10,000, 6,000 to 4,000 BC. When is the New Stone Age in China? At what year before Christ?
same din po yung answer ko sa number 1.
Okay, 8,000
8,000 to 10,000, 8,000
of course.
BC.
Di ba old
No.
yung Old Stone Age?
Ba yung
Mas
new?
maaga-aga. New Stone Age na to, Neolithic. So 8,000 to 2,000 BC. It's okay. Number 4, who is known as the god of acupuncture in Chinese mythology?
Bianke.
Uy, parang hindi
Bianke po ang nasa ano ko sa research ko.
Ano mo?
Is often regarded as a legendary physician and is sometimes referred to as the god of medicine or the god of acupuncture.
Yeah, but in Chinese mythology, the god of acupuncture is Fuzi.
Huang Di Neijing.
Hindi, iba rin. Fuzi.
Diba?
F-U-Z.
Fuzi.
Who is the god of medicinal herbs in Chinese mythology?
Shenong,
Yeah, Shen Nong.
also known as the divine farmer or divine husbandman or Yan Emperor.
Okay, very good. When did acupuncture start? Is it during the Old Stone Age or New Stone Age?
The ancient practice of acupuncture started in China approximately 3,000 years ago.
So that would
The
be
first documentation of acupuncture that describe it as an organized system of diagnosis and treatment is
Okay.
in the Yellow Emperor's Classic of Internal Medicine, which dates back to 100 BCE, before Common Era.
Wow. So during the New Stone Age, no? Because people were already crafting stones into fine needles and they are being used as instruments of healing. What is the earliest book written on Chinese medicine? When was it written and how?
Mahaba po yung sagot ko, Doc.
Sige po, okay lang. Okay.
Huang Di, also known as the Yellow Emperor's Inner Canon or the Yellow Emperor's Classic of medicine. It is traditionally attributed to the legendary Yellow Emperor Huang Di, and is believed to have been compiled around the late Warring States period, 475 to 221 BCE, and the early Han Dynasty, 206 BCE to 220 CE.
Okay. So actually, the first book called Neijing, no, was based on a series of conversations. O, di ba, nagbabalitaktakan lang sila. Between the Yellow Emperor called Wang Ti and his physician, Qi Po. They were discussing the whole spectrum of Chinese
Qi Po.
medical arts. Yon. So parang ano siya, recording, pero sinulat, no? So it was written in 305 to 204 BC. And we call this the Yellow Emperor's Classic of Internal Medicine. And there are two parts of it. The first part is Su Wen, or plain questions. And the second part is Ling Shu. Yeah. The miraculous
Spiritual
pivot or
pivot.
spiritual axis. Yeah. What is the focus of the Ling Shu?
The focus of the Ling Shu is primarily on acupuncture and moxibustion, detailing the theory, techniques, and practical applications of these treatments.
Okay. Hindi ko nalagay yung ano. Yeah, it's about acupuncture. Dinescribe dito yung meridians, yung function ng mga acupuncture points, even the needling techniques. By the way, you need to learn the needling techniques. Ha? Hindi tayo puro tusok-tusok lang. We will probably schedule maybe next year, no? Yung mga needling technique, yung tonification, sedation, and the types of qi and 160-point locations. So when did metal needles come into use?
Metal needles began to come into use during the Warring States period, 475 to 221 BCE, and the early Han Dynasty, 206 BCE to 220 CE. Prior
Okay.
to the widespread use of metal. Sige po.
Yeah, sige, tuloy mo. Interesting.
Ay,
Sorry.
ano po pang second ano po yun, question yata.
Okay. So pwede ka magturo.
Pang second question. Pasusunod.
Okay. So this was, di ba una-una stone, no? And then ngayon metal needles na during the Warring States era. So nagkakagera-gerahan na to. Can you imagine ilang taon sila nagigerahan, no? 9 types, that's why we have the Great Wall. 9 types of needles are named in the Ling Shu. Okay. When did Dr. Huang Fumi write the Senchu Chia Yi Jing? Or, yeah.
Around 259 CE during the Jin Dynasty. Jin Dynasty 265 to 420 CE, specifically around the year 282 AD.
Okay, very good. Ito yung tinatawag na Systemic Classics of Acupuncture and Moxibustion. So, 12 volumes yan, and it listed 349 acupuncture points. So, it makes sense, di ba? Ganun kadami. Maraming salamat, Dr. Froilan.
Okay, thank you po.
Thank you, sir. Now, let's call on the next one. Any questions before we proceed? I don't know if you love history, but let's make this a little more interesting.
Marami tayo.
Okay, can I call on Miss Palawan? Doc She, good evening. Good afternoon pa pala.
Hi, Doc.
Hello, how are
Sorry,
you?
I'm driving.
I'm sorry.
Wala.
Sige, it's okay. Naku, baka mag-ano pa ka. Wag na lang, nako-consent.
Wala.
It's okay po. We'll call you later.
Driver kaya ako.
Sorry.
Oo.
Concentrate in your driving. Tawagan natin si Ma'am Susan Valderrama. Good afternoon po.
Afternoon, Doc.
Yes. Okay, can you handle 11 to 20?
Okay, Doc.
Okay, very good. Okay, your
Tagaan niyo.
question. When did acupuncture become its own branch of medicine within the Imperial Medical Bureau?
The practice of acupuncture became a distinct branch of medicine within the Imperial Medical Bureau during the Tang Dynasty, especially between 627 and 649 AD.
Okay, very good. During the Sui and Tang dynasties, no? And then acupuncture schools were established. So, tingnan niyo po yung timeline, ha? 500, 600 AD. They were established and practitioners were called acupuncturists. So, ibig sabihin, may mga acupuncturists na noong 500 AD, 561 to 600. Also, during this period, Dr. Sun Si Miao wrote the Qian Qiniao Feng, which included data on acupuncture from various scholars. Later on, you will get to know more about Sun Si Miao. Next, when did Dr. Wang Weihe write the illustrated manual on points for acupuncture and moxibustion? During what dynasty?
During Shang Dynasty, around year 1026 AD.
Oh, diba? This book accompanied the bronze man statue, which is a life-size model of the acupoints on the human body. So, meron po tayong bronze man statue. Kaya kung pupunta po kayo ng Beijing, sa mga meron silang mga ganyan, no? Just to give honor to how acupuncture started. Number 13. What is considered the enlightening period for the advancement of acupuncture? Anong dynasty?
Tang Dynasty, Doc. 618 to 9017.
Enlightening?
1618, 617 AD.
Okay, sabi naman sa source ko, Ming Dynasty. Ewan ko lang yung iba, ha? Sige.
Actually, Doc, magkaiba eh. Meron din ako isang nano para iba din yung
Mm.
sinabi. Pero ito na lang yung sinulat ko.
Okay.
Ming Dynasty din sa akin to.
Sige.
Ming
Two
din
against
sa
one.
akin.
Okay lang po.
Yun din sa akin.
Magkaiba.
Okay lang. So, merong ginawang encyclopedic work, no? Ibig sabihin, maraming volume.
Ito yun siya.
Encyclopedia ba naman?
Pwede ko na
Bakit
yun.
encyclopedia dati, ha? 120 volumes. This was the foundation of the teachings
Hindi ako sa
of
pag-check.
Li Muran to introduce acupuncture to Europe. So, ang aga pala ng acupuncture sa Europe. Next, when did acupuncture become established in hospitals?
Acupuncture began established in hospital in China during 1950s.
Yes, under the leadership of
Communist
Chairman
government.
Mao. Oo. Alam niyo ba ngayon, kung pupunta kayo ng China and all other, lahat ng hospitals, meron na pong TCM, may Chinese na. Dito,
Wow.
lang po, Chinese Gen, through the efforts of Dr. Tan Cho Chong. Don't worry, we will talk to Dr. Tan Cho Chong. In fact, we're going to have, by the way, Dr. Tan Cho Chong is the chairman of the boards ng Philippine Academy of Acupuncture, Inc. And I don't know if it's, sabi ni Sir Abet, Dr. Tan Cho Chong is willing, magko-coffee daw kami. So marami siguro tayong pag-uusapan. Si Dr. Tan Cho Chong kasi, he has been with PAAI for the past 15 years. Yeah. Yun yung nag-umpisa pa, no? Sige po, we'll see. Malay nyo, this will be the start of a new era, no? Pangarap po talaga ni Dr. Palangka is magkaroon ng medical acupuncturist. Kaya we're very honored. We have the likes of Dr. Kua. Sana we will have more doctors who have an open mind and at the same time probably look at the modality in a different light, no? So dapat magaling tayo para we can actually see, we can actually explain how acupuncture works. Don't worry, this is just week 1. It's all about history. It's always good to always look back, no? Kasi sabi nga nila, if you don't know, ano ba yung sa Tagalog? Yung hindi marunong lumingon sa pinanggalingan, mukhang walang paroroonan
Hindi
yan.
nakakarating sa paroroonan.
Ayan, yung pala yun. Talagang alam na. So, ibig sabihin, may ano tayo. Alam ko medyo mahirap ito memorizein, pero Imperial Dynasty of China, known for its promotion of, ito po, what do you call this dynasty? Where pinromote na yung Confucianism and significant advancements in various fields.
The
Ma'am.
Tang Dynasty, Doc, 618 to 907 AD.
Ay, bakit iba yung sagot nyo?
Oo nga Doc, meron din dito.
Ano yung iba mong
Actually,
sagot?
madami.
Madami.
Han
O ano,
Madami
Han
na.
Dynasty din.
Han Dynasty.
Han Dynasty
Tang
din
din.
do.
May Tang din. Okay.
Opo, Tang Dynasty.
Wala akong tang.
Lahat talaga sila. Puro ano. Okay.
Han din
Oo.
Madami
siya.
sagot.
Ito napaka-obvious ng sagot. Historical period in China characterized by the rule of the Jin Dynasty from 265 to 420 AD. What do you call this period?
Jing Dynasty, Doc, 265 to
Siyempre,
420.
andyan na, Jin period ang tawag niyan kasi si Jin Dynasty ang mga star niyan eh. Okay.
Ay, galing.
Okay, who is this Chinese physician known for creating the first acupuncture charts and systematic assignment of
It's
Huang Day po, the Yellow Emperor.
Hindi, no.
Hindi.
Yun Doc yung ano ko eh.
O yung iba dyan, ano ibang sagot? Sige lang. Hindi
Wang
naman
Fumi.
yan si Wang
Wang
Dini.
Fumi.
Yeah, Wang. Ha?
Wang
Wang
Fumi.
Fumi.
Mukhang hindi.
Pero meron pa nga Doc
Wang
eh.
Fumi.
Yaw,
Wang
meron pa rin ako
Shuhe.
ganun.
Wang
Wang
Shuhi.
Ano Doc ang tama?
O Wang Shuhe daw. Meron akong kakampi. Wang Shuhe.
Wang Shuhi daw.
Yeah,
Yun sa
Wang
amin.
Shuhe.
Wang Pumi?
According to
Meron
Dr.
din ako Doc, Wang Pumi, 260 to 65.
May baka gawa-gawa nyo lang yan ha.
Hindi Doc ha, tatlo to. Kaya nga parang
Oh,
sinulat.
Wang
Nilalabas
Malu.
ito sa YouTube. Baka mamaya may mag-comment. Ano ba itong mga taga-Pilipinas? Binabago yung history. Okay,
Hindi
sige.
Doc. Sige
Huwag
nga
na-
sinulat.
Basta alam ko,
Kaya-
iba yung mukha ni... Hindi naman ito
Doc,
mukhang
kaya
yellow
ko nga
mukha.
sinulat eh, para maano kung ano daw talaga yung tama.
Yellow Emperor kasi hindi naman yan ang mukha, di ba? Si Wang Ti. Okay. Ito si Wang
Pero
Shuhu. Ganito pag-pronounce yan, Wang Shuhu.
Wang
Wang
Shuhu.
Shuhu.
Oo,
Wang
parang between O and E.
Wang Shuhu.
Okay, what do you call this dynasty, Ma'am Susan? Imperial Dynasty of China? Yung kanina, Confucianism, no? This time, it's about the development, played a significant role in the development of Chinese Buddhism and the construction of the Grand Canal.
So Dynasty Doc, 581 to 618.
Okay, wow, tamang-tama. Sui Dynasty. Very good. Let's go to number 19. What do you call the earliest tool used to perform acupuncture? Ang ganda ng ano, oh. The earliest.
Earliest, yung ano Doc, sharpened object like stone and
What do you
bones.
call that stone?
Wait Doc ha. Wait lang.
Pangalan pa pala yun.
Oo naman, may pangalan. Grabe ka naman.
Neolithic Doc, tama ba yun?
Alin? Ay, hindi ah. Neolithic, parang
Teka nga,
starts
yun
with
lang
letter
nakaano
B,
sa akin.
as in boy.
Ano Doc? Ano
Starts
mali ko Doc?
with B.
Wala, hindi yun eh.
Brian.
Yes, Bian stone. Later, bone
ulat
needle. Diba pinag-usapan natin sa Neolithic age, siyempre new stone age, no? Ang tawag sa stone, Bian stone. I don't know how that look like, pero baka gusto niyo pumunta ng Beijing to actually see. Later, they used bone needles and bamboo needles. So, ganun yung evolution na Pian stone.
Parang hindi ko ma-imagine pag yung stone itutusok sa'yo, no?
Di, matulis yun. Matulis na
Hindi
matulis.
nga, kahit na masakit.
Okay, last
Masakit
question
nga.
for you, Ma'am Susan. What were the earliest forms of moxibustion?
Ano na daw tama?
Hindi pa inimbento.
Sudan,
Hindi pa.
Zichen,
I'm sorry?
Zuozhuan.
Okay, can you describe to us how they did moxibustion?
Feudal dynasty text provides farthest evidence of moxibustion early use. secondary advisors discussion that occurred in 581 BC. Yun ang nano ko.
Actually, they discovered moxibustion when they discovered fire. Mm-mm.
Okay.
Nagamit yung fire. And as you can read here, they hit the stone or sand wrapped in an animal skin or bark and place it on the skin surface. And then localized hot compression was developed. Ganun po ka-crude. So of course, kung di pa nila na-discover ang use ng fire, this will not come into being. No? Thank you very much, Ma'am Susan. Thank you so much. Let's call on Ma'am Mabel Aba. I'm sure last week pa niya ito inaral. Miss Mabel.
Dok, 1 to 10. 1 to 10 lang po yung nasagutan ko. Sorry.
Andun kayo parating nagtambay sa ilang floors yun. Nakita ko yun. The Sheridan Hotel, Sheridan Towers. Okay, let's go to number 21. In 1973, there were scrolls that were discovered at the Han Tomb, number 3, at Mawang Tui. They were the earliest texts describing the theory of channels and collaterals. So that means talagang talaga nila na there were really documentations. So can you describe these scrolls in 1973?
Silk Scrolls and
Ano po? Okay. This was called the Moxibustion Classic. And with 11 foot and hand channels, and moxibustion classic with 11 yin yang channels. Okay, whatever. Let's go to number 22. What do you call this text that describes the theory of acupuncture, moxibustion, and point needling manipulation? This was given earlier, no? Ni Doc Froilan. Ano po tawag dito? What do you call this book? Based sa would you like to tell us again? Do you have the answer, Ma'am Mabel? No?
Dok, wala po kong sagot. 1 to 10
May
lang
sagot.
po yun na.
Sinagot na ito kanina ni Doc Froilan. Doc Froilan, can you tell us the answer, please?
Wang Di Neijing.
Yeah. Or the Wang Di Internal Classic, yung nire-record. Kasi, okay, mamaya na. Number 23. Watto authored what book? Ano yung book na sinulat niya? Actually, later, you will discover, meron tayong mga points sa likod. The Watto Chiachi points. Okay, so, anong tawag sa book na sinulat niya, Ma'am Mabel? No answer?
No answer po talaga, Dok.
Sige, siguro we can ask Sir Tyrone or Dr. Tyrone to give the answer.
Good afternoon.
Good afternoon.
The book is called the Zhenjiu Jiayi Jing.
Wow,
The Systematic Classic of Acupuncture and Moxibustion.
Okay. This is called the Canon of Moxibustion. Yeah, the classic. Classic is Canon. Canon of Moxibustion and Acupuncture. Preserved in Pilo. Imagine mo sa Pilo piniserve. Who is this?
Mr. Clean.
No. He further developed. So in-enhance niya the methods of acupuncture and moxibustion. And he has a book called Treatise on Febrile and Miscellaneous Diseases. He emphasized combining acupuncture with medicinal herbs during treatment. Okay, before we continue, for naturopaths, it is very important marunong kayo mag-combine ng mga supplements with acupuncture. Okay? So you should know the supplements that can do cleansing, especially pag may excess conditions, and you should know the supplements that are nourishing, especially when you have deficiency conditions. Make sense? Excited? Okay. And I discovered something about castor oil. O, diba? Thank you so much,
Yes,
Dr.
Doc.
Janine.
Ginagamit po namin ng
grabe.
castor oil.
Parang nakita ko parang iba yung glow. Pero hindi mo ilagay sa doon sa Ay, mamaya na lang. Ay, Dr. Tyrone, who is this, doctor? Doctor ba to?
Hindi kasi naturopathic eh.
What do you-
That
what-
is Zhang Zhongjing.
Okay. Okay. Chang Chong Ching. Chang Chong Ching.
Shang Chongqing.
Zhang Zhongjing.
Chang Chong. Okay.
Zhang Zhong.
Ito na si Wang Fu Mi, a medical doctor, compiled which book? Hindi mo nag-compile na.
Yun ulit. Ako po, Doc.
Yes, kayo
Hindi,
pa
kasi-
30.
Ah,
Ikaw yung
okay.
lifeline ni ni Ma'am Mabel. Okay.
Okay po. The book is called The Canon of Acupuncture and Moxibustion.
Okay. Yeah. Or the AB Classic of
Or
Acupuncture.
the AB Classic of
Iba-iba
Acupuncture.
His
Iba-iba.
book consisted of 349 acupuncture points,
Acupuncture. Wow, 349
manipulating
pala yun.
techniques and precautions that need to be taken when providing acupuncture or moxibustion treatment. It is considered the most influential work. So, kaya very prominent na medical doctor to. Wang Fu Mi. Parang ito yata ang idol ni Dr. Froilan. Because I heard him mention kanina. Next, Dr. Tyrone.
Yes,
Ano
Doc.
naman yung kinumpile ni Sun Simiao?
Compiled two significant medical texts. Number one is the Beiji Tianjin Yaofang and the Qinjin Yifang.
Ano yun?
Oh,
Ay, nagmali pa yung pagsulat ko. This is worth, yeah, they are correct. But this is the English translation. Prescriptions worth 1,000 ducat or fold for emergencies, plus a supplement to the prescriptions worth
Ito.
1,000 gold.
Essentials po. Iba ang sabihin mo. Iba ang,
okay.
iba po yung sabihin mo. Iba yung,
Doc, yung palang yung Beiji Tianjin Yaofang, yan yung essential formulas for emergencies worth and 1,000 pieces of gold.
Yeah, these are the two hero two.
Dalawa yan. Yung isa supplement.
Oh, dalawa yung kanyang
Ang
significant
galing.
medical texts.
Okay, can you tell us about the
Mhm.
book? Location of Ashi. Ashi points were described for the first time. He also formulated the charts of 3 views on the which are the earliest multicolored charts depicting the channels and points. So may tatlong views. Okay, question. Dr. Tyrone, does acupuncture leave any wounds on your skin? Choose from the 4.
Letter B. Letter B, no, because there are thin needles not causing any bleeding.
Okay, so you should explain that to your client. And you have to make sure na hindi masyadong nararamdaman ng client, no? So,
Yes, Doc.
it's something that you have to learn by yourself. Next, number 28. Ay, nakalagay na yung answer. What did ancient China believe acupuncture would help the body release?
Letter A, Qi.
Okay. So, acupuncture is simply manipulating the qi, no? What was the name of the mummy?
Uy,
Nakakatakot naman to. That was found to have acupuncture points. So may
letter B, Otzi.
Ay, wow. Kilala mo. Close kayo.
Pasyente ko yan dati, Doc.
Okay, what would they use instead of thin needles that we have today?
The
Before.
letter B, sharp bones and stones.
Okay, very good. Congratulations po, Dr. Tyrone.
Thank you,
Patapos
Doc.
na yung naturopathy nyo, para tuloy-tuloy na. Maraming salamat. Next,
Maraming
we
salamat
call
din po, Doc.
on,
Really?
Jennifer Duran. Good afternoon po, na medyo excited sa patient niyang may MS, multiple sclerosis. When it comes to multiple sclerosis, it's best to consult someone who has had patients. And I'm sure nakatulong si
Autoimmune.
Sir Albert.
Mahirap yun. Autoimmune yun eh.
Oo, matagalan po ang treatment niyan.
Opo.
Okay, so are you ready from 31 to 40? Ma'am Jennifer, who was the founder of Confucianism? Ma'am Jennifer, mukhang nawala yung sound niyo.
Hindi ako ready daw.
Ay, hindi ka ready. Oh, sige, okay lang. Uy, dapat next Monday ready ka na. Una-una kinang tatawagan. Okay.
Mhm.
Next, okay lang po, okay lang po. Alam ko mas priority niyo yung patient, no problem. Let's call on Miss France. Ma'am Mercy.
Yay. Mercy. Good
Mercy.
afternoon, everyone.
Good afternoon po. Who was the founder of Confucianism?
It's letter D, Master Kong.
Master Kong, that's him. True or false? Confucianism is a religion that enforced people to practice arranged marriages.
It's false. Because
Oh.
it's not a religion, but it's a philosophy. It's a system of ethics and social principles, kaya hindi siya religion po.
Yeah, so hindi siya religion. Very good. What was the founder of Confucianism's purpose for creating it?
The purpose of Confucianism is to encourage others to practice equality within their community.
Okay, and
No,
also, actually, there are two answers here, no? To renew it after the Zhao Dynasty was destroyed, letter C. Actually, lahat naman yan, lahat naman yan, you just have to get the best. So, 34, the Han government created schools in order to prepare the students for
Civil service, eh?
civil service. You have to serve the country. 35, why were females not allowed to attend schools in the Han Empire?
The answer is B. In ancient China,
Nawawala na. Mukhang hindi yata siya agree dito sa sagot. Nawawala yung signal. Ay, ano yun? May bagyo na ba?
Wala pang bagyo, Doc. May choppy lang.
the female
Naku,
teacher
dapat choppy siya. I think she answered B. Yeah.
And
Yes, Doc. B sagot.
kids.
Oh, you see? Yung future,
Mag-alaga.
napaka-ano naman ng future ng babae last ancient China para lang makapangasawa and have kids. Yun lang po. Okay. What was the reason the Han Empire wanted to expand? Ano yung signal niya, no? Can you hear your voice, Ma'am Mercy? Hello po. Naku, nawala na siya. Hala. Are we good?
The letter
So what's your answer here, the third one?
mahina yung signal ko.
Sige,
Kanina
huwag
okay
ka tayong
naman.
gumalaw. Okay na.
Yes, po.
What's your answer here? The reason why Han Empire wanted to expand. Ay, nawala. O sige lang, we will call on you again later, Ma'am Mercy. In the meantime, letter. Naku, ano ba yan? Nawala na siya. Yen. O sige daw. Letter.
幅だよね。テーブルの、椅子のところね。うん。
Okay, ano yun? Ay, ready na si Doc She. Nakapark na siya. Okay.
No, not yet.
Ay, hindi pa ba? Ay, sorry. Okay, who
Kasi
will...
nasundo ako ng kids ko, Doc. Wala kasi ibang driver.
Sige, okay lang yun.
Sorry, next time.
No problem. Tawagan natin ulit si ano. Sino kaya? Ay, baka some of the batch 2, the former batch 2 would like, batch 2 na po kayo ha, kasi para naka-program na kayo mag-graduate. Ay, what's happening? Okay, let's try calling. Okay lang po, I can call someone from the other batch. Let's call on Dr. Janine. Ano na ba nangyari sa signal natin? Am I coming in clear? Clear pa po yung
Yes,
signal?
Doc. Loud
Okay.
and clear.
Yes,
Okay,
Doc,
let's
okay
try
naman po
Baguio.
sa inyo.
Doc Janine, Miss Baguio, would you like to answer? 36? Mukhang wala. O balik na lang tayo kay Sir Froilan.
May tumatawa.
Dr. Froilan.
Sabihin mo ano, may ano tayo, may Zoom meeting tayo.
Hello, Mama Mia, tawag ka mamaya. May Zoom meeting kami ngayon.
Hindi, may Zoom class.
Oo, tawag tayo.
Okay,
Yes,
36.
Doc. Number 36.
36.
Letter C, their primary goal was to unite all of China.
Okay, unity. Number 37. Who named the Silk Road?
Letter B, Ferdinand von Richthofen.
Very good. Okay, let's talk about the Silk Road. Ito po yung Silk Road, no? It was a network of Eurasian trade routes active from the 2nd century BCE until the mid-15th century. No? It spans over 6,400 kilometers. It played a central role in facilitating. So ibig sabihin ito yung nag-ano ng trade nila during that era. No? Okay, why was why was the silk an important part of the civilization? Dr. Freud, can you answer?
The answer is A, B, C, and D.
Yeah. All of it.
Yes.
Why did the people of different civilizations spend their inheritance on long distances with the many dangers?
Answer is letter E, A and D.
Yes, very good. It was a large way to get new materials, technologies, and products. And the rulers wanted to grow their civilization. So high-tech na sila before, no? Number 40. What did the Great Wall of China help achieve?
Letter B, to keep out invaders and protect China.
Very good. So you all know that. Which dynasty built the Great Wall of China?
The Qin or Qin dynasty? Qin
Dynasty.
Qin dynasty.
Qin. Okay.
Qin.
Actually, nauna na siya i-build before, but connected siya, connected by the Qin line. Parang sila na lang yung nagpatuloy. Okay. Sino yung pinapaalis? Which group did the wall help keep out? Ito po yun sila. Wow, ganun.
Xiongnu.
Okay. Uy, kahit sino na lang ha, para yung may answer, paunahan na lang. Xiongnu. So, tribal confederation po yan. Nomadic people, mga nomads, no? Who inhabited the Eastern Eurasian steppe from the 3rd century BC. Okay? So, Medyo ano daw sila, very powerful. Who invented the first ever, meron pala silang earthquake detector. Oh, di ba?
Meron.
Shanghai.
Si
Wow,
Shang Heng.
very good.
Yung,
Yeah, Kang Heng. What material was used to make Chinese paper?
Mulberry
mulberry
tree.
tree.
Galing. Okay. During what dynasty was gunpowder invented?
Tang Dynasty.
Ano lang.
Uy, sigurado
Ito
kayo?
naman dapat. Meron na siya.
Sino may ibang sagot?
Song yan eh.
Song.
Okay.
Si Song yan eh.
Kayo I'm not saying we're correct, no? Yeah, but we can always
Okay.
check. Depende na lang yan sa magiging comments. What is Confucianism?
A system.
System.
Yes, so it's not a religion. What was the reason for the founders' rituals?
To define civilization and cultural sequences.
Galing. Okay, letter B. What influenced the strictness of Confucianism?
Excessive amount of fighting, and others in the community had to abide by what is stated.
Or people could have their own religion.
Isa pa yun.
Ang alisin dito is yung dalawa. Yung excessive amount of fighting, and people could have their
Couldn't have
own religion. So ibig sabihin, only abided by what was written. People could not have their own religion, others in the community. Ay ganun sila ka-strict. What was the Han Dynasty known for?
great technological, cultural, and social process.
Sino may ibang sagot?
Economic achievement.
Sino pa may iba?
May letter A.
Ay, nandiyan na pala si Sir Mark. Letter A, the largest Chinese historiographic work.
Oh.
What is the center of early Chinese society?
Family.
Of course. Why were the women more respected when they give birth to? So, ibig sabihin, hindi ka na-respetuhin pag babae yung anak mo. Why?
Kasi sa kanila, the son would pass down the family name and they were considered better than women.
Yes, sadly, no? More parang ngayon din. So, yeah. Okay. What are two reasonable options if the wife couldn't give the husband a son? Two.
Marry someone else.
And?
Consider abortion once they find out.
Yeah, consider abortion. Oh my God.
Wow.
Once you find
Sakit
out
naman.
Grabe.
Sabi
No?
lang.
Sige, delete natin to. Okay. Who is Qin Shi Huangdi? What does the name mean?
The first emperor of Qin.
Yeah, the first Chinese emperor. How long did the Qin dynasty last?
15 years.
Okay. 15 years.
Konti lang.
Letter C. What did Qin create to protect him after he died? Imagine mo, namatay na siya.
Yung ano po, yung terracotta army.
Okay, yung terracotta. Alam mo ba, nilibing pati. Grabe, no? Nilibing siya. Okay.
May movie yan eh, nakalimutan ko lang.
Oo, merong movie. O di manood na ko tayo. Okay. What are three things that were traded on the Silk Roads? Anyone? Doc Tyrone. Narinig ko yung boses ni Sir Mark.
Doc, iba po yung sagot ko eh. Silk
Ano?
spices and precious metals.
So, andun siya siguro sa fruits. Grains.
Pwede ito sa fruits, peppers, and crafted items.
Letter C. Chinese inventions. Where were the Silk Roads located?
Western China near the Mediterranean.
Nakapunta ka na dyan, no? Mediterranean.
Ay, mahirap pumunta. Nasa norte kami, nasa south yan eh.
Oo nga. Who
Oo.
started the trade routes? Which dynasty?
Han Dynasty.
Yung ano,
Hindi.
hindi mo ikaw
Ay,
sasagot.
hindi pala.
Shao Dynasty.
Si Zhao. Okay.
Ganyan yung mga itsura. Okay. Why did Tao get renamed to Tao? Oo, no? Bakit naging
Nga naman.
Tao ang Tao?
They moved to the west.
Yes. Ganun pala yun. Pag nasa West ka, nagiging T ang D. What did Taoism teach? Ganun.
To give up worldly
Yes.
desires to be in nature.
Oo, just like your post, no? You are in communion with nature. O, di ba?
Yes.
Ngayon kasi parang ang layo na natin sa nature kaya nagkakasakit na. Okay.
Totoo po.
Ay, totoo pala. Hinulaan ko lang yun. So yung mga nakatira sa malayo, yung mataas na, yung, di ba parang ang layo-layo mo na sa ground, do they get sick
Yung,
more?
opo, kasi yung earth energy, yung doon po nanggagaling lahat ng pagkain natin eh.
Okay.
Tapos, we can directly get it from the ground. Kaya kung malayo tayo sa ground,
Medyo mahirap. Kaya pala.
walang grounding.
So are you saying, yung mga nakatira sa matataas, like yung mga high-rise condo?
Yes po. Malayong-malayo na po sila sa sa ground. So sa earth energy masyado na silang malayo. Kaya stress, grabe sila kung ma-stress. Hindi nag-ground. Hindi nawawala.
Ay, sige ko. Oo nga, no? Hindi ba pwede maano yun na magtanim ka din doon ng parang forest?
Maganda. Mas maganda po.
Para ano, di ba? Kaya pala yung iba, meron ng mga ano sa taas, no? May mga nature na din.
Mga nature po. Tapos manggagaling naman po yung energy from the cosmic. Sa sun naman.
Okay. Amazing. What other philosophy goes hand in hand with Taoism?
Confucianism po.
Very good. Letter A. Okay. The period in human history characterized by the use of stone tools and the development of agriculture. Paulit-ulit.
Neolithic era or the New Stone Age.
Yeah, 6,000 to 4,000 BC. Books or written works describing medicinal drugs, their uses and preparations.
Materia medica.
Or the pharmacopoeias, no?
Pharmacopoeias.
Okay, ito naman, I think medyo mali yung question, but you need to specify year. So ngayon ko lang talaga nalaman na gano'n na pala katagal, no? So ear acupoints for specific health disorders were discovered. No specific anatomical pattern reported for the ear. So ibig sabihin, they never thought of the ear as an inverted fetus, no?
Mm-hmm.
And they only know na may mga young alarm points sa ear. That's the reason why we have points that are tender. Yan yung mga young alarm points. So anong year po ito, Ma'am Mercy?
Ay, wala po akong sagot. Ear pala. Year?
Yeah, 200 BC. But this is not the ear points that we know now, huh? Okay, as early as 200 BC, 200 years before Christ, there were already ear acupoints for specific health disorders. But there was no specific anatomical pattern. All they knew was there were young points found on the ear. 200 BC. Next. Anong year naman ito? Yung ear piercing and ear cauterization for sciatica. Sa history.
17th century. Parang 1950s.
Ay, hindi.
3,000
na
BC.
pala. Look, don't worry, I'll give a copy of this. Ancient Egypt, Greece, and Rome. 3,000 BC, 100 BC. Ang tagal na. So it did not originate in China, the piercing thing. Kaya di ba mahilig sila mag-beauty-beauty sa Egypt?
Okay.
Egypt, Greece, Rome. So can you travel back in time? Next. Ano namang year to at saka what country? Yung cauterization of the ear for the treatment of sciatica.
Yun yung yung 1950s.
Hindi.
Persia yan, Doc. Persia.
Yeah,
Hindi pa
Persia.
rin. Persia
Yeah,
pa
very
rin.
good. Ancient Persia, 580.
Oh,
Ang tagal na pala, no?
ang tagal na pala.
I think it's a bit.
Wow.
Yeah, very good. Ito naman, another history. Dutch East India Company doctors bring acupuncture to Europe. Acupuncture needle insertion evolves to hypodermic needle. Ano pong year ito?
Yung 1683?
Yeah, the Middle
1500.
Ages. Earlier,
17th century. 17th century.
1580 and onwards, no? Okay, please discuss the history of auriculotherapy in modern Europe from 1950 to 1990. Nawala yung iba.
Ang haba nito, Doc.
O sige, please.
Nandito ako, Doc. Nandito ako.
No, yeah. Would you like to participate, Doc Janine? I
Sige,
saw
Doc.
you're enjoying. O sige, I know you love
Okay,
this.
Doc.
Kasi we need to understand how this came about, no? Kasi we cannot just make a guess, no? So in contrary to what we knew, no, what we learned, akala natin 50s because of Paul Noger, as early as 1580 sa ancient Persia.
Wow.
Okay, can you tell us what happened? Now, especially if we wanted to really focus on auriculotherapy, we should know the history. Okay, Doc Janine, it's your floor.
Yes, Doc. The answer's there na. It's
Yeah,
Dr. Paul Noger and Dr. Bordeaux, Dr. Frank Barr, who observed scar on the sciatica patient treated by lay practitioners. You made this kwento, Doc.
Yeah,
developed inverted fetus perspective of ear in 1957.
Yes.
The somatotopic pattern on ear connection to reflex pathway treatise of auriculotherapy focus on musculoskeletal pain. So, yun, Doc. Tapos yung mga nakita na niya, reflex cardiac,
And then they did the pulses. They have this technique called the RCA. French lang to. I don't know if I pronounce it right. Nakakaya kay Miss France. Reflex cardiac auriculae. Vascular harmonic signal. And then the group.
Impulse.
Okay, whatever. Basahin nga, Miss France, yung GLEM.
GLEM.
The GLEM.
Well, the GLEM. Andun sa kabilang ko hindi ko ma-open.
Yan bang hindi mo na pinopronounce yung S na etu?
Okay. Po? Basta yung dulo, hindi na pinopronounce.
And then they initiated trainings to physicians, no? And then there was a World Health Organization meeting in Lyon, France, in 1990.
Lyon, France. Lyon, France. Nasa south yun eh. South ng France.
Okay. Andun nakatira yung yung anak ni Dr. Paul Noger. So
malapit po kasi sila sa Mediterranean.
Okay. Interesting. Now, let's go naman sa history. What happened in modern China na to, ha? Not ancient. 1950 to the 1990s.
Okay. Ako pa rin ba, Doc?
Yes.
Pwede.
Okay. This is the revitalization of ancient Oriental medicine by Mao Zedong. The Chinese doctor learned of the inverted fetus model of Nogier in 1958, and barefoot doctors utilized somatotopic model of the ear. The Nanjing Army Ear Acupuncture Team validated Nogier's ear map, and H.L. Wen of Hong Kong discovered the use of ear acupuncture for for addiction by needles inserted in lungs and the Shenmen.
Amazing, di ba?
Oo nga.
So,
yan pa rin ba ngayon, Doc? Lung and Shenmen?
Yan
Oo.
pa rin.
Yan pa rin.
Ang ganda.
Andyan,
Now, sa
ano na,
United States naman, 1970 to 1990.
This is the integration of Chinese and European auricular microsystems, UCLA controlled study by Oleson and others on auricular diagnosis.
You see?
The doctors examining ear blind to patients' musculoskeletal problems. Ano yung ear blind, Doc?
I don't know.
ano daw?
Ah,
75.5%.
doctor examining the ear blind to patient's musculoskeletal problem.
Okay. Wala kasing,
Okay.
punctuations dun. And
Yeah.
madami
So
pa
that
doon.
means
Ang dami-dami.
they did trial and error thing yata dito. So parang all they did was to locate the musculoskeletal problem on the ear, no?
Okay. So, ang dami pa, Doc. New York,
Mm-mm.
and then the Auricular
There's the
Therapy
NADA,
Certification Institute,
the NADA
1999.
Detox Protocol, the
Si,
5
si Nada, si
ng
Mr.
Shenman
Smith.
liver kidney sympathetic.
Mm.
The International Consensus Conference on Acupuncture Auriculotherapy. O, meron ng auricular medicine pala, oh.
Yun na nga di ba?
Meron na po.
Kaya nga,
Pero baby pa po.
Yeah, ipon-ipon na tayo para sana mangyari sa 2027. It's always good to have certificates from another country, no? Kunwari, galing ka ng France. Kasi pupunta tayo ng France, no?
Yun na, pwede naman dito.
Auricular microsystem. Can you discuss this? What is this?
The microcosm. Sige, Doc. Ano na?
Sige po.
Sige po.
The ear is a microcosm of the whole body, meaning it has a specific area on the ear representing different parts of the body.
Yeah. And also, meron tayong meridian channel, the macroacupuncture. So, ang microsystem pala, which is the ear, actually connects to the macroacupuncture meridian channel. That's why you have to be aware na saan yung lung meridian, sa ear, saan yung large intestine, all this stuff. And then we have distal acupoints on the hands and feet for remote treatment sites. In fact, we're thinking of doing tunes, no? Was able to find materials that were very easy. In fact, I would like to share it with you later. And we'll probably post it on YouTube. So it's good to be doing combination, no? Distal acupoints. Medyo masakit lang itong distal. No? Okay, what is onotopic inversion, Ma'am Mercy?
It is a term that describes a phenomenon where a spatial organization of sensory or motor information in the brain is reversed compared to the actual physical body.
Okay, so it's interesting to note that it was Dr. Paul Noget who came up with this upside down pattern, no? Inverted fetus thing. And the Chinese were very happy. They learned from it. Okay, what is this ipsilateral representation?
It refers to the brain representation of the body parts on the same side of the body as the brain region processing information.
Yes. And so in ear acupuncture, yeah, so we have reactive ear points found on the same side of the body, pathology. And then if you have pathology in the body, they project to the contralateral brain. So ibig sabihin, if you have right knee pain, it's the left brain, left side of the brain. That's why it's good that meron po tayong training sa scalp, no? And then contralateral brain projects to ipsilateral side of the ear. So ibig sabihin, okay. So ganun lang. Next.
Kahit saan pwede.
Tell us about the biological holographics.
Oh, wow. Ang daming na lumalabas.
Yeah.
Kasi sabi nila, may yung nag-imbento kasi yung si Dennis Gabor, pero si Mike T-Bolt ba yun? Yung siya yung naggumamit na mismo sikat na gumamit na nung biological holographic.
Yeah. Okay. Dr. Zhang Yinqing. Okay. What are the treatments? Meron tayong Ma'am Desiree Go. Would you like to participate? It's a new name. Welcome po, Ma'am Desiree. Okay.
Hi po. Good
Hello
evening
po.
po.
It's good to have you. Maraming salamat po.
Yes po.
Were you able to get hold of the questions already before today?
Ay, sorry po, hindi po, Doc. Just
Okay lang.
invited.
No problem, Ma'am Desiree. I understand. So, I'll be calling you next week for Yin and Yang. I would like all of you to be familiar with the Yin and Yang philosophy, especially on its clinical applications, no? Lahat lang talaga binabalance lang talaga natin yung yin and yang. So, as early as next week, we would like you to be very familiar with deficiency patterns, excess patterns. Yin excess, yang excess, yin deficiency, yang deficiency, and their classic symptoms. And also the organs, no? Na masyado ng expert yung ibang batch. But again, it always pays to have a review. Okay, who would like to answer this? What were the treatments used in the ear so far?
So far, yung needles sa ear, tas yung ear seed, saka yung magnetic aculotherapy.
Yeah, press
And what
stocks.
else?
Seeds, bleeding. We can also bleed, especially pag mataas yung blood pressure. Kung ano yung gumamit ka nung pang-bleed. 3 edges. You can do massage of the ear. There's a technique. Electrical stimulation, cold laser, and injection. Ear seeds are from what plant?
Pacaria plant or cow herb or soapwort.
You can leave this for a few days and up to 2 weeks. No?
Oh, wow.
What is the action of ear seeds? Kaya nga very safe yun eh. What does the
stimulates the specific points on the ear which corresponds to the various organs and system in the body. Hindi kailangang parang invasive yung puncturing kasi sa ibabaw lang po siya.
Yeah. So it's basically stimulating the movement of the chi through the meridian. So ganun lang din po, no? And it can also interrupt the rerouting of neural messages. It also stimulates endorphin release, feel-good hormones. So pumping. Facilitates detoxification from drugs and alcohol. So ibig sabihin, I think we should try to come up with yung medyo maganda naman na ear seeds, no? It can alleviate withdrawal symptoms. So that means it has to be there for a long time. It can reduce cravings. This is true, but it will not reduce the cravings if we don't press them, no? Restoration of equilibrium, restoration of energy and vitality, relief of restlessness, reduction of hypersensitivity, reduction of anxiety, relief of pain, promotion of sleep, promotion of physical and psychological well-being. Are you not excited? Ang dami palang uses.
Wow, dami pala.
Yeah.
Oh, sobra amazing talaga.
Yes.
Dami.
Saan ka dito, Sir Mark? Hindi ko nakikita yung pangalan mo rito. Bigla na lang lumitaw yung boses niya. Ay, tawagan ka. Okay, let's ask Sir Mark. Fill in the blanks. Ear seeding is a technique based on the theory of blank acupuncture. Sir Mark.
Doc, may pasyente po ako, nagmamanipulate po ako.
Ay, sorry po. Sorry. Okay. Okay, nakikinig lang siya. So the answer here is very easy.
Auricular
acupuncture. The use of auricular acupuncture for therapeutic purposes was first mentioned in Chinese medical texts beginning in the blank century AD.
2nd century.
6th century, Doc.
6th.
4th century AD.
Ay, bakit iba-iba?
6.
Sige, check natin. Fact check natin, ha? Sige. Who is
Based
this
on the
French
text later.
doctor that came up with the modern map of the ear?
Paul Noget.
Yes. And I think he
Paul
died in
Noget.
1998, 1996. So yung anak na niya
1996.
1996.
1996 siya namatay.
Okay. And I'm sure you know what he died of.
Yeah.
Ako hindi ko alam. What did he die?
Esoteric kasi siya eh.
Ay, ganun. Sige, wag na esoteric na. Baka wag po na sina Sir Froilan. Andiyan na naman tayo. But anyway, really, that's interesting. Esoteric. Bakit ba namatay na lang siya bigla?
Kasi hindi sila nagkasundo ni Bourdieu dahil dun sa esoteric siya, tapos si Bourdieu masyadong scientific. Kaya nag-part way silang dalawa.
Tapos sa galit niya?
Di naman po. Nagtagal pa naman yung practice niya bago siya namatay.
Okay.
Anong kinamatay? Ano
Kasi sabi lang namatay.
Hindi siya nagpa-acupuncture kasi.
Matanda na rin kasi siya eh.
Sige na,
1996 eh. 1996 parang 20, ano lang yun, 27, 27.
Paano iwan yung earseed sa tenga?
Tanungin natin si Dr. Kua kung nakikinig siya or baka may sagot si Dr. Terence Kua. Dr. Terence, are you busy with your patients? Si Dr. Kua.
Nag-drive po, pero malapit na ako sa bahay.
Hala, sorry.
Pero nakikinig ako.
Ay, okay. O,
Nakikinig naman.
Thank
Okay
you po. I'm sure next week you'll find it more interesting. I hope you were able to get a copy. It's so important, Yin and Yang. Next, ear seeding as a specific technique utilized within auricular acupuncture was developed in what country? In
France.
France, 1950s.
1950s.
Bakit iba yung sagot ko? Hindi ko nga din alam bakit ito eh. Parang hindi
Si
yan.
1958 po kasi yung somatotopic ni Paul Noget is 1958 yung sinasabi, pero before that kasi nag-aral na siya in the early 50s.
Okay.
Pero yung mga writings po kasi niya na-publish nung medyo middle to late 50s na.
But I think yung ear seeds were discovered much later na, no? After the
Opo.
So,
Kasi ano po na...
Anong sagot niyo rito, Sir Tyrone?
Saan ba yan?
81.
1950s, sir.
Para sa amin ang sagot.
Korea. Ear seeding yan na. Ear seed.
Ear seeding? Sa Korea pala?
1970s. So parang 20 years after Paul Noget discovered.
Wala ka namang sa ano? Wala kang
Korea.
Meron palang Korea?
A study published in the Journal of Alternative and Complementary Medicine found that ear seeds were effective in reducing blank in women undergoing breast cancer.
Anxiety.
Ang galing.
Anxiety.
So, gamitan na ng ear seeds, no? Malay niyo, tawagan kayo lahat. I'm sure hindi lang sa breast bulb. Mga any medical...
Shenmen lang siguro to. Shenmen.
A study published in the American Journal of Chinese Medicine found that ear seeds were effective in reducing blank
Pain
Anxiety
and anxiety.
problems.
Fatigue in women with breast cancer. Buti ginawa na nila, no? Alam mo, makakatulong talaga yan, lalo na yung mga in pain, no?
Oh, wow. Ear seeds pwede na.
Siguro with the help of Dr. Kua, he can help facilitate, especially on his patients. Dr. Kua pala is an occupational medicine practitioner. So, puro mga ano yan.
Doc, may concern po ako regarding ear seeds.
Opo.
Yung ibang mga patient ko, 'di ba, nung nag-training tayo about auriculotherapy, yung, di ba si ma'am nagbenta ng mga ear seeds. So ginamit ko sa mga patient ko yung mga mga
Namutol.
diamond pa. Natakot lang ako kasi pumapasok doon sa ng tenga,
Kanal.
natatanggal, kuwari natutulog sila yung sa kanal.
Tanggalin mo na lang.
Kaya in-stop ko po yung
Actually, may
recommend.
na-discover. Ganito na lang, may isi-share ako. May na-discover na naman ako. Hindi pa ginagamit dito. Wala namang nangyari so far. You know what's this?
Intradermal.
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 Alam mo, paalisin mo lang, lalo na pag may aso sila, before sila matulog. So, pwede mong i-recommend na bumili sila ng tweezer kasi they need something to pull it out. Ay, naku, ang ganda ng effect, no? And this is what you do. First, di ba, you feel the pulses, you feel the and then you discover ano po yung organ na affected at the same time, kung deficient ba or excess. I think magaling na kayo dyan. Then you use the 4-point needle technique, right? You use it on the left if the patient is a male, and on the right if the patient is a woman.
Female.
Now,
Female.
sa kabila, di ba, bakshu? Especially if the problem is already chronic and medyo may edad na yung pasyente. So definitely we'll have to use bakshu. Yung mga ginamit nyo na points, example, gallbladder, bladder, and stomach, usually they always come as a group, no? So you will be using the bakshu points on the other ear. Okay? Kasi yun yung mga chronic eh. And at the same time, you have to address the acute. So this is where you use the front me or the alarm points. So you need to be balik mo naman dun sa kabila. So ibig sabihin, yung concern talaga niya, here, dito. So you have to count the number of, alam nyo, ang ganda talaga. I'll share it with you if we will have the chance to meet. But if not, you have to do it. It's so amazing. Yung iba, pag wala namang aso or hindi naman ginaganon yung kamay nila, pero there's always the risk na baka pumunta sa mata, no? So yung dito. Kasi pag okay na yung treatment, fall off siya. Yung isa kong pasyente, takot din. Kasi yung aso niya, dinidilaan yung tenga niya pag gising niya. So yun. Anyway, so sabi ko, tanggalin mo na lang pagkagabi. Di ba may mga may mga intradermal needles, para medyo maiba. You just have to get the best tweezer, no? Kasi you don't just, if you use ang hirap niya ipasok, ganon. So, again, you should have your probe, no? You try it. Yung lang, di ba, usually 4 points, yung Korean needle technique, and then another, kasi tatlo lang naman yung ginagamit na 3 points for the bakshu and another 3 points for the front move on the same ear as the 4-point needle. So you have a total of 10. And
Doc, how about po? Doc, how about yung press needle instead of ear seed?
Yung press needle kasi, hindi mo siya ma-incline eh. Hindi mo siya yung oblique yung insertion. Oo. Kaya parati lang siyang perpendicular. And I feel that the press needle, design talaga siya for flat surfaces. Yung ear natin hindi flat eh. So that was discovered by Dr. Ryan. He said, now I found out why it hurts. Try mo. Between what's this? Press needles and intradermal needles. The intradermal needles are more tolerated or better tolerated. So you try it. 4-point needle, then 3 points of bakshu, another 3 points front move, or you can add yung she cleft point. For example, sumasakit yung chan, you use stomach 34, the she cleft point, or sumasakit yung likod, you use bladder 63, she cleft point, diba? You need to know these things. I'm sure you have that chart, no? So pag may mga pain, you use the she cleft point. That's only one.
Hindi ko na.
So ngayon, ay wow, ang laki, grabe.
Kayo nagbigay nito, Doc, di ba? You gave this, the bakshu.
Oh, yeah.
Yeah, you just enhanced it. Yes, yeah.
And then this one.
How do you determine the bakshu? This is what you do, ha? First, di ba, you use the intradermal. So, tinan nyo, pabago ba? Tinry ko, ang ganda talaga. Like, I had a doctor, an ophthalmologist, kasi si ano, kilala ito. Alam mo, impressed na impressed siya. Because before I needle, I would always feel the pulses, no? Because for you to be able to, wait lang. Okay. For you to be able to know ano yung organ, first you need to know ano ba yung which came first. Kasi sometimes it's so difficult, no? Like between the spleen and the kidney. So lalo na pag malamig yung kamay, no? So you would always think of, this could be probably kidney yang deficiency or spleen yang deficiency. Which came first? So pag nakita mo naman matagal na siyang mataba, so most likely yang. Anyway, ang ano kasi doktor, if you got the right diagnosis, you listen ha, even the first needle, grabe yung impact sa pulse. Yeah. Grabe yung impact sa pulse. Talagang iba na yung pulse niya. Usually, pag yang deficiency, di ba malalim? Umaangat na siya. Yung case naman ni, buti nang wala siya dito. Yung isa kong pasyente na I see every Wednesday. And when sabi ko, what happened? You know, I don't see any changes in your tongue. Kasi parang, if you tell him to avoid eating this and that,
lalaki.
si Dr. Ryan, ay bahala siya. Anyway, ang laki ng tongue, phlegm na phlegm, tapos may yellow coating pa na super thick, and the pulses are bounding, as in, bounding, super bounding. If you look at the back side of the tongue, the posterior third, so kasi ganito yan eh, it's between the front and the back, no? Heart and fire. So, nagdo-dominate talaga yung bladder heat.
So, kasi kulang siya sa grounding, kaya ganun, Doc.
Oo nga, puro fire. Pero alam mo, first 2 needles sa Korean. So, I eventually, sabi ko, ay, malakas kumain. So, sabi ko, nakita ko yung let's do stomach excess, no? Inano ko yung stomach excess, so stomach fire. Kasi bounding na bounding yung pulse eh. So, di ba una-una mong aayusin yan would be sino ba yung controlling element ng stomach? Di ba? So, it's the gallbladder. Ay, isang point pa lang, wow, talagang na. And what more? So, this is what you do. You needle 4 points for the Korean 4 points. Pagkatapos, ayusin mo yung...
Hindi lumalabas yan. Pati yung binti na yan, no?
Ayusin mo yung back shoe. Nag-iiba talaga yung pulso. And so, yung case naman ni doktora, yung may neuropathy, because she just finished her first cycle of chemotherapy for her CA. So she was seeing me. Sabi ko, I don't think this is because of the chemo lang eh. She has had it already before. So there is liver blood, pati single at 40, 43, 44. So you will be looking at an issue with the uterus. No. Alam mo, nawala first needle. Na-feel niya kaagad sa ano niya. Nawala yung neuropathy as in. Amazing. So you should be able to know the diagnosis talaga. Yeah. So yun lang. You use the intradermal.
Nagamit ko yun, Doc, sa hospital.
So how was it?
Yung pagdating kasi dito, kasi nandyan pa ako, nagsuffer na ng severe toothache yung husband ko. So yung past pala niya, parang pumunta na dun sa pinaka-root ng ngipin niya. So yung nerves niya, talagang first time kong nakita siya umiiyak dahil sa sakit. All day nung day na yun, Doc, di ba nasa airport tayo?
Oo, nakita pa
Lagi na
tayo
siyang
sa
nag-ano sa
medical.
akin. Oo, sa airport. Medyo worried na ako nung time na yun kasi wala nang gumagana sa kanya na pain reliever. Kahit yung mga dentist na mga friends namin, tinulungan na siya nung Arcoxia ba yon na pain reliever?
Arcoxia.
Hindi pa rin talaga siya. Tapos sabi niya na if ever hindi pa rin mag-subside, magpa-IV na ng pain reliever. So di ba nauna ka mag-fly. So after 1 hour nag-fly na ako, noon yung time na tinurukan na siya ng
Okay.
IV na pang pain. So,
Mm.
ako didiretso dyan pagkalapag ko. So, ang biyahe ko, Dok, mga 1 hour and a half. So, almost 2 hours kasi maghintay pa ako ng bagahe ko. Hindi pa rin daw nawawala yung sakit na ngipin niya. As
Okay.
in, grabe
In
talaga.
spite of the IV alcohol.
Kulang sa drain yun. Dapat drainain yung gums.
Nawawala na.
Dinidrain ng gums.
Oo.
Ayun. Dinidrain ng gums nun. Saka mo siya
Hindi kasi
applyan ng ano.
alaman. Before siya
ano na.
pumunta ng hospital, that afternoon, pumunta siya ng dentist. Hindi siya
Pagdating
dinalaw
ko,
ng dentist. Binigay lang sa kanya is antibiotics at saka yung dynamic. Pagdating ko, kasi sabi niya sa akin, i-ano mo na ako agad kasi sobrang sakit na talaga. Sabi ko, okay lang ba? Nasa hospital setting tayo. Ayoko rin maano ba kasi syempre may mga doktor doon. So yung attending physician niya, nagpaalam siya na pwede ba akong i-acupuncture ng wife ko kasi para ma-relieve lang ako talaga ng
sa
pain.
ear lang.
Kasi pagdating ko doon, dito may ice dito tapos may chinuchu pa siya na ice kasi yun lang nagpapa-relieve sa kanya eh. Pero masakit daw talaga. So
Then,
yung isang ear pa lang, sa isang ear pa lang siguro mga 5 minutes medyo nanahimik siya konti. Sabi niya, tapos napansin ko na parang namumungay na yung mata niya. Sabi ko, ay, nag-okay na to kasi nagkalma na siya konti. Tapos maya-maya sabi niya, hihiga na ako, gusto ko nang matulog.
wow.
Nakatulog siya. Nawala
Talaga.
yung pain niya. Bilateral ginamit ko kasi parang sabi ko, para sure talaga.
Oo.
Doon talaga siya nakatulog. Tapos, mga 2 a.m., nag-discharge na kami. Yun, itinulog niya yung intradermal to hanggang umaga.
Wow, congrats.
Nice.
You know, that's good news.
Very.
Although I had to admit, I didn't know if it would work or not, but it worked. Diba?
Oo. Actually, nagdadalawang isip din ako. Sabi ko, paano pag hindi umano to, hindi nag-igi.
It's
Sabi ko, naku,
experimental.
kakahiya. Oo, experimental talaga. Kasi
At saka,
experimental ito, 8 talaga, Doc. As in,
oo.
grabe daw talaga kasakit. Mantakin mo, every 1 hour na siyang umiinom ng pain reliever, walang nagwo-work sa kanya. Even the IV, walang nagwo-work sa
So
kanya.
he felt a lot better. Kumusta na siya ngayon? I'm sure you have to really treat the cause. Baka merong ano yon, merong ng ano to.
Nagpunta kami sa dentist kinabukasan kasi pina-x-ray ko yung ano niya, Doc, yung buong bibig niya.
Okay.
So wala namang nakitang problema. Nung nagpunta kami sa dentist, yun nga, pinalitan yung dating pasta. Kasi
Okay.
yung dating pasta parang nagsadsad sa pinaka
So,
ano ng so na-touch na yung mga nerves doon sa root ng ngipin niya.
Na-open yung root canal niya.
hello, Dr.
Opo.
Kwa. Yeah. Na-interest. Alam mo na-amaze tuloy si Dr. Terence. Ang bata pa pala ni Dr. Terence. Parang,
Kaya, Doc, turuan mo ako doon sa ano ko sa patient ko na magpa-schedule yung may Parkinson's disease. Kasi yung sobrang sakit na ng ulo ng patient eh. So wala ring nakaka-relieve doon sa
Okay.
pain ng
sa Parkinson's kasi, una-una, di ba, alam naman natin yung pathology niya, no? And sa Chinese kasi, we would, si Dr. Kua, are you Chinese?
Chinese ako.
Di ba? Kailangan careful tayo sa mga pronunciation natin. Alam ko pa lang naman sa Mandarin, yes. So that's interesting, you know. Sa ano kasi, when you have Parkinson's, you need to know if it's definitely wind, no? Kasi gumagalaw eh. So you have to really look at the liver sa Chinese. And since it happens mostly, siguro yung pasyente mo medyo elderly na, no?
Yes, Doc. Actually, hindi ko pa nakikita yung wife ng yung nakausap ko.
Yeah,
sabi
and
ko, gusto ko may assessment muna.
Karamihan, I think most elderly na may Parkinson's, they have a very thin disposition. Yung parang tawag natin doon yin deficiency. Medyo payat siya, di ba?
Hindi ko pa siya na-meet personally,
Hindi
Doc.
po ba
Kaya
Okay.
i-update kita.
Mamaya na.
I-update kita.
Oo, check mo talaga yung constitution niya. Kasi usually, it probably came from a yin deficiency of the kidney and liver. No? Kasi ang liver pati ang kidneys, they have a mutual relationship. And for people who are prone to have yin, kaya nga dapat attend kayo lahat sa Monday. Aralin nyo na kaagad yung principles para ano. So, para happy lahat. Tingnan mo, nakauwi na si Dr. Kwan, hindi pa tayo natatapos. Pag-usapan natin sa Monday, hindi po pa na nakikita yung pasyente. O sige, usually yung ano nila, mga medyo payat yan. And of course, there's movement. If there's movement, that's wind. That's probably, kasi there are actually many patterns that will give rise to wind. So you need to really read up on it. Okay? So Dr. Kua, we're really honored that you are with us. And we hope that because of your expertise in, sana we will be able to deliver what you want. We will try our best. Any comment, Dr. Kua?
Saan po? Okay lang. Mahaba naman yung journey ng Chinese medicine.
Oo nga, mahaba. So, timing lang po.
Learn lang.
Kayo. And we're very excited. Dito po kasi, like an acupuncturist or a TCM practitioner would always look at the tongue and the pulse, feel the pulse. In fact, we look at the tongue to be able to determine the cause of the problem. Kasi we may be able to treat the symptom but or the manifestation. However, kung hindi mo na-address yung cause, then you will have a patient who will, have the same problem over and over again. So being able to determine the cause is something of a challenge. Sa Chinese po kasi, no, as a TCM, example, if you have a diabetic patient, you may have 10 patients who are all diabetic, but their patterns are different. So ibig sabihin, the approach is not the same, no? We look at the tongue to actually monitor the progress. So first, we look at the coating of the tongue. If it's too thick, then we hope to be able to see a reduction in the thickness of the coating. Kung wala ding coating, which usually happens when you have, ganito kasi nangyari sa iyo, Doc She, no? Yung pasyente mo most likely walang coating yung tongue, no? Pag wala ng coating ang tongue, that's yin deficiency with empty heat. Mamumula na yung tongue. And when there's too much heat, there will be wind. Okay? When you see the patient, we hope you will be able to present it on Monday. We want to be able to see the tongue, and you should give us the pulse reading. Okay? We're excited. Tuloy na natin para matapos na mukhang bored na si Who is Dr. He here and what was his significance to TCM? Sagutin mo na, nakaano ka naman dyan, Doc She.
Hindi ako prepared.
Okay, Doc.
Hindi ako prepared, Doc.
O sige na lang, si Dr. Sir Froilan.
Dr. Yi He, commonly called as physician He, during the 6th century before the Common Era or before the Christian era, was regarded as a founder in the classical medical tradition of China and China's first medical naturalist. The physician who was extolled for his attunement of the will of the spirits as well as his powers of examination.
So, siya nagbago. Noon kasi,
Witchcraft.
Akala nila na-possess ka or kinulam ka. No? And it was Dr. E. who put forth the 6 causation factors. And what are these, Sir Froilan?
Wind, cold, heat, dampness, dryness, and fire.
Nung araw, ito yung tawag sa anim. Yung nung araw. Yin, yang, rain, wind, night, day. Tapos gumamit ng tortoise shells and other animal bones. Describe the earliest form of a medical system in China. Actually, if you are an emperor, you have all the amenities. This is the setup. Ito po, ano lang para mabilis.
Ayun lang.
Ito for the
For the emperor and
his family. Ito po yung kanyang staff. Okay, meron siyang internal doctor, internal medicine. Then meron din siyang nag-a-advise sa kanya
dietary.
sa diet, no? Nutrition. And then somebody
Yeah.
who's in charge of the trauma and also dermatology.
Trauma.
Kaya maganda yung mga kutis nila. And also a veterinarian. So yun. Describe the key differences between Confucianism, Taoism, and Buddhism. Sir Tyro.
Oh. Dok, ang haba po nito eh. Sige,
basahin
Ikian mo lang, mga keywords lang. Ako na lang.
Ito na lang.
Confucianism is about
Open
social
naman.
construct. Taoism is a philosophy. Buddhism is a religion. Baka naman mamaya, inano pa yung history nito. What are the four? Kayo na lang to ha. The 4 TCM First Classics. There are actually 4 big books.
Yan, meron.
Of course, yung Huang Ti Nei Ching, Inner Canon of the Emperor. Then the Shenong Pen Tao Ching. Okay. Classic of Difficult Questions. And then we have Shenong Ben Kao Ching. If I pronounce that right. And then the Shanghan. Ano, itong Shanghan, ito na yung mga whole disease religious disorders. What is the importance of the inner canon of Yellow Emperor? Anyone? Dr. Janine, can you help?
It's the encyclopedia of TCM.
Yes.
So meaning the basic questions of life, the body relating to everyday
Ito na mo, ang tagal na, no? 2,500 years
ago.
Older than Jesus Christ. Okay. What format is the inner canon of Yellow Emperor?
Yes.
Ganyan po,
Two texts.
Yayaman.
There's 2 texts, 81 chapters, 2 Wen, Plain Questions and Lingshu, Miraculous Spiritual Pivot, dialogue format between Yellow Emperor and Chibo.
Very good. Later compiled the earliest annotation of the inner canon of the Yellow Emperor. Oh, here's the mukha. Okay.
From Shang Dynasty.
Who later compiled the annotated instructions on part 1? Di ba may 2 parts? Part 1 of the inner canon of Yellow Emperor, basic questions. Ito yung parang interview nila.
Ito si Wang Bing.
Yes, Wang
Bing.
Who is, how do you pronounce Chibo?
Chibo. An enlightened mythological healer employed by Yellow Emperor as his minister.
Okay, so ito yung ano, actually, ano yung ay? Nagulat ako. Okay, para matapos tayo. Describe the first part of the inner canon of Yellow Emperor. What does it contain?
Basic theory, prevention or life cultivation, diagnosis and treatment principle.
Wang Di.
Okay. Describe the second part of the inner
Yung physician ni Wang Di. Tapos kausap siya. Tapos yung conversation nila.
This is Meridian, needle technique, and Chi.
Yeah. Okay. Ito na yung idol ni ano.
Yun, addressing treatment strategies.
Ginagawa niyang ano.
Bianche.
Yeah, Bianche. Ay. Tanungin natin si Dr. Ko, ano pronunciation niyan?
Che. Joke.
Mas credible si Dr. Ko mag ano. Okay, nickname ito from a healing bird daw. So parang bird na rin pala siya. He brought the dead back to life.
Oo nga eh. Grabe.
Who is Watwo? Ay, parehong mukha. Sorry.
Ito ba, Doc, yung first anesthesia?
Yeah, first famous surgeon to use mafe powder for abdominal surgery. What is Watwo? Parang may tunog
Yun
ito.
yung cannabis,
Dr.
di ba,
Webb. How
Doc?
do you pronounce this, Dr. Kwa? Alam ko may ano yan eh. May where you put the Kwato chat.
Hindi ko po alam kapag hindi ko nakita yung characters.
Ay, Diyos ko.
Kasi,
O doon nakabase sa character, no? Thank you po. Points created by Huato along the spine. Actually, these points, no? Itong, di ba we have Bakshu? Yung kanya naman from here, oh, from the cervical, thoracic, lumbar to here. 0.5 soon from the midline. Yan. So pwede mong gamitan ng mga ano yan. I-experiment mo daw, ano. Actually, you try doing this on scoliosis patients. Gawin mo daw. Di ba ang dami mong press needle? Ay, kaya lang mahal ng press needles.
Press needles na lang, Doc. Tama.
Kasi it's so malapit eh. 0.5 soon. No?
Oo nga.
Ano bang kalahati ng ano? Okay, malapit na tayo. Who was the great pulse diagnosis expert? Sana all. And what book did he put it forth?
Treatise on Febrile Disease and Golden Chamber. Tama ba, Doc?
Wang
Shuhe.
Classical pulse is sphygmology. Next, describe the classic of sphygmology.
Ayan.
Ako na ba? Ako na lang. 24 categories. Ngayon, may 29 na categories. Pero ano na lang aralin natin? Baka masiraan tayo ng bait. 5 na lang or 6. No? Though we now learn 28 pala. Ngayon 29 na po. When did doctors start to focus on the study of etiology and symptomatology?
2nd or 3rd century.
After the 6th century. So this is the last slide. So you can see the timeline. No? So yung pinaka-importante po dito ito, and as you can see here, hanggang sa 2000 AD, 3000 before Christ. So we have the Huangdi, the father of Chinese medicine. Yan na lang. Sige na, I'm sure gutom na po kayo. And thank you so much for your time. We hope to see you again on Monday.
Thank you, Doc.